Welcome back, everybody. So exactly 4 months ago, on the 27th of March, Health Minister Zweli Mkhize and the National Institute for Communicable Diseases confirmed the death of a 48-year-old woman with comorbidities who had tested positive for COVID-19. That was 4 days prior to her death. To date, 6,769 people have died from the virus and 445,433 have tested positive. Joining us now to discuss this is Professor Jeffrey Mphahlele, who is the Vice President for Research at the South African Medical Research Council. Prof, it's great to have you. Thanks very much for being with us here on the program.
Thanks for having me, Leanne.
So I want to go back to 4 months where that was announced South Africa would go into a lockdown. At the time, we had, I'm just going to quote from what we're running in the news now. The country had 927 cases and 0 deaths at the time. We fast forward to today, and that infection rate and death toll is astronomical in comparison to where we first started. Let's just dwell on that for a little bit. This infection rate we're recording, was this predicted, or is it just moving at a much faster pace than we ever thought would happen?
Yeah, it is unbelievable, Leanne. And I think what we can learn from what happened is the fact that nobody ever anticipated that we will be challenged by COVID-19 up to the stage where we are. And where we are at the moment, we are at a stage where we have to really believe that COVID-19 is real, it is here, and it will continue to be here with us. And it's not something that is going to disappear in the next 2 or 3 months.
Yeah, it certainly isn't. And, when we look at the figures and we look at how South Africa has suddenly climbed up in terms of the infection rate, I mean, we were doing pretty well, holding our own within the month of June, and everything seemed to be under control. And then suddenly there was just this skyrocket of infections that came through. What do you attribute this to? I mean, why has it, in a way, as you say, nobody actually predicted this would happen, but what can we attribute this to? Is it behavior? Is there something else to it? Or is it the fact that we as a country are testing a lot? But perhaps you can make us understand why we are looking at this kind of number.
Well, this is expected in terms of the number of cases that we had, because we knew that after the lockdown we will have an increase in number of cases. But obviously we didn't know exactly how many cases we will have, despite all the predictions and models that we had. And I would say that we just have to realize that nobody has got a solution to this virus. And many countries were taken by surprise by the virus, and South Africa is no exception. And I think if we embrace that, we will be able to be serious with all the precautions that we need to take. Because at the moment, the only solution that can help us to slow the community transmission is taking the non-pharmaceutical patients seriously. So that's what I can say at the moment. Yeah.
Mm-hmm. I mean, we obviously are now, when it was first recorded, a death here in South Africa, it was a 48-year-old woman who had a comorbidity in the form of a pulmonary embolism, which obviously, for those that don't know, is a blood clot that occurs in the lung. And we now, as we say, 4 months on, what does the research indicate that we in South Africa should specifically be focusing in on?
So I think what we should be focusing on in South Africa is the fact that we don't know everything about the virus. So every precaution is important. And if you can think about all the debate, and I'm talking about the public debate, not really the scientific debate that we had since the beginning of the pandemic in South Africa, it's been very interesting because if we take example, for example, with the use of masks in the public, that was a debate at the beginning, and we didn't really believe that everybody should use a mask. And where are we now? We are at a stage where use of the mask mandate, and we continue to have this debate. The current debate that we have about taking a break with the schools, and there are people who say it's the wrong decision, and there are people who say it's the right decision, and I think both groups are right in the sense that those who are saying it's the wrong decision, they do have their reasons why they think it's the wrong decision, and those think it's the right decision, and they also have their own reasons. So I think, despite this, public debates, we should continue to really observe pharmaceutical intervention.
Yeah. We look at, and I keep focusing in on the numbers because it's all we really have at this point in time. And you at the South African Medical Research Council have, in fact, not personally yourself, but the council in itself has said that, although the death toll is sitting at over 6,000, this is likely to be an undercount of what's actually really happening here in South Africa. I can imagine an undercount in terms of virus cases and of the death toll. And that is worrying in itself. Perhaps you can elaborate a little bit more on this for us.
I agree with that completely because if you look at the testing in South Africa, we prioritize people who are sick and people who are on the priority list, like the healthcare workers. So if you were to test everybody, obviously the numbers would be more. And if we were to do another test, which is able to tell us about fasting over and above, this testing that we are doing, the numbers will be even more. At the moment, we don't know the true number. So what we see is just and I think it's just an indication of where the country is going in terms of new infection. It's not a true number. So WHO, and I think should accept the fact that the testing is not optimal, and we have got many more cases of COVID-19. If you include asymptomatic cases and people who may want to test because they had contact with COVID-19 confirmed cases, and they can't have access to this test.
I mean, I agree with you, and that's just from if you look at sort of close circles of people you may know, and I included in myself, I can think of 3 families that I know, families of 4, that one person has tested positive. All of the people in the house are sick, but only one person is tested positive, and the others sort of just go with the healing. So, that's already 3 people tested out of possibly 12. So, that increases the numbers as well. But let's look at 4 months ago. Early on in March was when the very first COVID-19 positive case was identified locally. We remember it very well. It was somebody coming into South Africa. It was a group that had gone out overseas. They came back and got infected. What is your opinion as to how the pandemic has been dealt with in South Africa so far? Do you think a lot of people believe this? We locked down too soon?
Yeah, well, that is an interesting question. My take is that the public health response in South Africa was not that bad. So the lockdown was a good decision. Because if you remember, what was the purpose of the lockdown? It was about preparing the healthcare system. But we knew that 4 weeks or 6 weeks was not going to be enough to really remedy the situation that has been with us for many, many years and many decades. But it's been able to help prepare for the epidemic. And in terms of healthcare system, we had some expansion of the healthcare system, especially the high care level. We had to expand the testing capacity in the country. And if you look at the number of cases, especially the new cases that are reported, it looks like we are able to close to 50,000 in a day. And that is incredible. And one can only say that we are able to do this because we had the opportunity to prepare for the capacity. And there have been many other things that have been done. If you think about the problem of the PPE, we still have it, but we had the time to think about how we can address the shortage of PPE, and we also had the time to address other things. So the list, of course, is endless, but the lockdown was definitely a, but it was not meant to address all the problems that we had.
And certainly not, because as we say, I mean, this is a novel virus. It's something new. It's something that's never been around before, and so every day is a new learning curve. We spoke about preparedness, and we were told that everything was behind the scenes being prepared. The virus is now spreading at an exceptionally fast rate, and more deaths are being recorded. But at the same time, hundreds of thousands of people have also recovered. The issue of beds in hospitals, and some people being forced to lie on floors, some people being turned away from hospitals, not having enough oxygen in our facilities. We know that our health system was already overburdened, and now it's now, I don't know how to describe it, but perhaps I'll leave that to you. But do you believe we are going to be able to deal with what is expected to be even more and increasing infections in the country?
I wish I know the answer to that question. Yeah. I think that we are doing something in terms of responding to the pandemic. Unfortunately, we won't have a perfect solution because the COVID-19 disease and the infection is just a challenge. And when you respond to a public health emergency, your response should be simple. Your response should be very responsive to the problem that you have at hand. And at the moment, the country is doing that, but unfortunately, the demand outstrips, the supply. And because of this, there will always be some. So not everybody will be able to get optimal attention that is required. And the country should just keep on doing what it can to try and address this.
I want to pick your brain about hitting the peak of the crisis, and we keep on saying that obviously we have to be very, very careful, and we've seen July has been a massive month. We were warned about the numbers. August is going to be, I imagine, very much so the same from what we have been warned from yourselves and the rest of the health officials, and going into September as well. Once we've reached this peak and we sort of almost over that, what then? Are there fears of second infections, or is it that, we can try and go back to life as we know it and live alongside this virus? But what does it look like? I mean, what are the plans going forward once we've come to the end of the peak?
Well, if the experience from other countries go by, one can say that we should be cautious, because we might have an initial peak in South Africa, but that doesn't mean that the virus will go out. it is possible that we can still experience second and third peak as we go along. The only thing is that we don't know when this will happen. But for the first, the expectations are that this will happen probably between August and September. But unfortunately, the virus will still be with us.
Indeed.
So it's not going to be a situation where after the peak we relax and we feel that we have conquered the virus. Actually, after the peak, it will be the period where we need to strengthen the non-communicable.
Finally, Prof, and we need to talk about this, the trials and the vaccine, because until we get a vaccine, everything we've spoken about up to date is not going away. And that is, we know this as a fact. So here in South Africa, obviously there are human trials going on. Around the world, there is possibly one of the fastest races ever to find a vaccine. Let's talk about the speed at which this is happening firstly, and where South Africa stands in line. Do you think that obviously there's been talk about the fact that we wished we were a lot more advanced in terms of developing a vaccine, but the use of the vaccine around the world and access to South Africa. Let's perhaps talk about all of that and whatever you can tell us about so far the trials.
Yeah, so the trial is doing very well. And I personally believe that we will have a vaccine for SARS-CoV-2. And the only thing that we are not sure at the moment is about access to the vaccine, because if we only have one vaccine, it's going to be a challenge to manufacture enough doses to supply the whole world. We would like to see a vaccine that is available to everybody, rich and poor. And one vaccine will not be able to do it. I just hope that the candidate vaccines that we have, at least we've got 3, which are in advanced stage. I just hope that at least 2 will make it. And from these 2, we should be able to have the vaccine for most countries in the world and for most people who are in need of the vaccine. Because we have to be realistic. At the beginning, the vaccine will not be available to everybody. There will be groups of individuals who are prioritized, especially those who are at high risk COVID-19 and who are like, but the prospects are good, and the early results that we have seen, they are also very encouraging. And personally, I believe that we will have a vaccine.
All right, Prof, we thank you so much for your time. Professor Jeffrey Mphahlele, the Vice President for Research at the South African Medical Research Council, talking to us about various issues. But the reality is that today marks 4 months that South Africa has been in a lockdown. It was declared 27th of March today, 27th of April. Let's get our news on this day at 7 o'clock.